Welcome back to the PTCB Top 200 Drug Series. I'm Izzy, certified pharmacy technician with 9 years of experience, 179 drugs covered. Today, episode 16, and we are covering the final major infectious disease drug class, the antifungals. Antifungals are not just tested on mechanism of action. They are a goldmine for the PTCB because they bring three of the most significant clinical concepts together. Extreme CYP4 150 drug interaction profiles, specific dosage form counseling points, and hepatotoxicity warnings that pharmacy technicians must be able to flag. When you see a patient profile with warfarin, phenytoin, or simvastatin, and a new antifungal is ordered, you have to know which one is the culprit. We are going to use the Suffix trick to classify every single one of them. 13 drugs, 3 antifungal classes, 1 primary mechanism of action, 3 critical safety warnings, 5 practice questions. Let's go. Here is the framework. The PTCB organizes antifungals primarily by their suffix, azoles, the azole suffix, fluconazole, Diflucan, ketoconazole, Nystatin, itraconazole, Sporanox, voriconazole. Mechanism. These drugs inhibit the enzyme 14-alpha demethylase, which is required to convert lanosterol to ergosterol. Ergosterol is the essential component of the fungal cell membrane. If the fungus cannot make ergosterol, its membrane loses integrity and the cell dies. The PTCB critical facts. First, drug interactions. The azoles, particularly ketoconazole and itraconazole, are potent CYP3A4 inhibitors. They interact with an enormous list of medications, increasing their levels to dangerous concentrations, including warfarin, simvastatin, and phenytoin. This is the single most tested drug interaction concept for antifungals. Second, hepatotoxicity. All azoles carry a risk of hepatotoxicity. Patients must be counseled on symptoms of liver dysfunction, jaundice, dark urine, abdominal pain. Third, fluconazole utility. Fluconazole is the most commonly prescribed antifungal because it is well absorbed orally and has excellent distribution, even into the CNS. It is often prescribed as a single 150 mg dose for vaginal candidiasis. Echinocandins. The fungin suffix. Caspofungin. Mycofungin. Mechanism. These drugs inhibit the synthesis of beta-1,3-D-glucan, a key component of the fungal cell wall. The PTCB critical facts. First, all echinocandins are injectable only. They are used for severe systemic fungal infections in hospitalized patients. Second, they have a very low drug interaction profile compared to the azoles. They are not CYP inhibitors. Terbinafine. Brand name Lamisil. Mechanism. Inhibits squalene epoxidase, another enzyme in the ergosterol synthesis pathway. The PTCB critical facts. First, primarily used for onychomycosis, nail fungus. Treatment is long, often months, to allow the new nail to grow. Second, hepatotoxicity. Terbinafine has a well-documented risk of hepatotoxicity. Baseline and periodic monitoring of liver enzymes is standard. Nystatin. Mechanism. Polyene antifungal. Binds to ergosterol in the fungal membrane, forming pores that cause cell contents to leak. The PTCB critical facts. First, not absorbed orally. It is used topically or for oral candidiasis. Thrush. When used for thrush, the counseling point is swish and swallow, or swish and spit, to ensure contact with the oral mucosa. Second, Nystatin is never used for systemic infections because of systemic toxicity. Now let's lock in the brand to generic connections. Fluconazole, brand name Diflucan. Azole class, vaginal candidiasis, single 150 mg dose, CNS penetration. Ketoconazole, brand name Nystatin. Azole class, topical shampoo for seborrheic dermatitis. Oral formulation rarely used due to liver risk. Itraconazole, brand name Sporanox. Azole class, the strongest CYP inhibitor. Capsules and solution are not interchangeable. Terbinafine, brand name Lamisil, onychomycosis, hepatotoxicity warning, long-term use. Think. Lamisil, the nail fungus, fine. Nystatin, brand name, Mycostatin, polyene. Thrush, swish and swallow. Topical, think. Mycostatin, the thrush, statin. 5 questions, PTCB format, let's go. Question 1. A patient is prescribed itraconazole for a fungal nail infection. His medication profile includes simvastatin, 40 mg daily. What is the most appropriate action? A. Dispense the itraconazole. Simvastatin and itraconazole have no interaction. B. Flag the prescription for pharmacist review. Itraconazole is a potent CYP3A4 inhibitor and significantly increases simvastatin serum levels, increasing the risk of rhabdomyolysis. C. Counsel the patient to take the medications 2 hours apart. This prevents the interaction. D. Suggest the patient switch to Nystatin. The answer is B. Itraconazole is a potent CYP3A4 inhibitor, and simvastatin is a substrate. Flag it for rhabdomyolysis risk. Question 2. A patient is dispensed Nystatin oral suspension for thrush. What is the correct counseling instruction? A. Swallow the medication immediately with a full glass of water. B. Swish the medication in the mouth for several minutes to ensure contact with all oral surfaces, then either swallow or spit as directed. C. Apply the medication only to the lips. D. Dilute the Nystatin with grapefruit juice to increase absorption. The answer is B. Nystatin is not absorbed systemically. It must have direct contact with the oral mucosa to treat thrush. The swish and swallow instruction is the counseling point the PTCB tests. Question 3. Fluconazole is most commonly prescribed as a single 150 mg dose for which condition? A. Onychomycosis. B. Vaginal candidiasis. C. Invasive aspergillosis. D. Systemic cryptococcosis. The answer is B. The single-dose regimen for vaginal candidiasis is the most frequent use case for fluconazole and the most tested. Question 4. Which of the following antifungals is only available as an injectable formulation and is used for severe systemic infections? A. Fluconazole. B. Terbinafine. C. Caspofungin. D. Nystatin. The answer is C. Echinocandins, including caspofungin, are intravenous only and reserved for severe systemic infections in hospital settings. Question 5. A patient on long-term terbinafine therapy for onychomycosis should be monitored for which of the following? A. Renal failure. B. Hepatotoxicity. C. Bone marrow suppression. D. Hyperglycemia. The answer is B. Hepatotoxicity is the specific safety warning associated with long-term terbinafine use. Monitoring liver enzymes is standard clinical practice. 13 drugs. 3 classes. Azoles, Echinocandins, others. 1 CYP3A4 interaction anchor. Azoles inhibit metabolism. 1 swish and swallow rule, Nystatin. 1 nail fungus drug, Terbinafine. 1 single-dose utility, fluconazole. You now know 192 of the top 200 drugs across 16 episodes. Drop a comment. What antifungal question always trips you up? I'm Izzy, certified pharmacy technician with 9 years of experience. And I'll see you in episode 17. Subscribe so you don't miss it.